Last week I saw a gentleman. He is 74-year-old and his doctor diagnosed him with polymyalgia rheumatica or PMR, which is relatively common inflammatory condition that presents with a lot of pain in the shoulders and the hips, and people feel stiff in the morning. His inflammation tests like ESR and CRP were high, and he was getting better with the prednisone. In about 4 weeks, he was scheduled to have surgery on his neck or cervical spine. When I spoke to him more, I realized that he had several other things going on from his young age. He told me that he had a back surgery on the lumbar spine, lower back. He had been having lower back pain with morning stiffness as well as nighttime pain for years and years, for which he would take medications like Advil or Aleve. His aorta was slightly enlarged. He had required surgery on the Achilles tendon at the heel for tendinitis and rupture. And somebody in his family had Crohn's disease. After listening to this for half an hour, I realized that this is not a straightforward PMR. There's something more going on. I examined him. He had severe limitation at the neck and the lower back. And when I performed blood tests, he had positive HLA-B27 gene, and X-ray showed that his sacroiliac joints were actually fused. Nobody had done an X-ray of the sacroiliac joints until now. It was all X-ray of the lumbar spine and MRI of the lumbar spine, MRI of the neck that was showing degenerative changes but not the typical findings of ankylosing spondylitis. The symptoms started when he was 35 or so. This is not the only exceptional situation. This is what happens from time to time when patients have symptoms going on for years and we diagnose them at later stage when the damage already has been done. Ankylosing spondylitis or axial spondyloarthritis is one such condition that can remain undiagnosed or hidden for years and years. The average delay in diagnosis is about 7 to 14 years. And I think this is unacceptable. What I'm trying to say is rheumatic diseases can remain hidden because symptoms may be not that severe to begin with. They occur slowly. The damage happens slowly. If you have low back pain that started at young age, you have morning stiffness, the back pain gets better with activities but not with the rest. If the back pain wakes you up from your sleep, and you also may have other symptoms such as psoriasis, eye inflammation, bloody stools, heel pain, family history of psoriasis or Crohn's disease. If you want to know your risk of having ankylosing spondylitis, we also call it axial spondyloarthritis, go to backpain.today. We have developed a screening survey called A-Tool that will tell you what your risk is and whether you should see a rheumatologist or not. I'm Dr. Abhijit Danve. I'm a board-certified rheumatologist with more than 15 years of experience, and I specialize in taking care of patients with ankylosing spondylitis. Stay connected with Access Room.